Order. Now call the meeting of the Standing Committee on Public Accounts to order. My name is Kelly Regan. I'm the MLA for Bedford Basin, and I'm the chair of this committee. I would remind my colleagues to place their phones on silent, and I'm going to ask committee members to introduce themselves, beginning with the Vice Chair, Mr. Young.
Good morning, everybody. Nolan Young, MLA for Shelburne.
Mr. Taggart.
Good morning. Tom Taggart, MLA, Colchester North, and welcome.
MLA McDonald.
Good morning. Johnny McDonald, MLA for Hants East.
MLA Sheehy Richard.
Good morning, everyone. Welcome. Melissa Sheehy Richard. I'm the MLA for Hants West.
MLA Lachance.
MLA Lisa Lachance from Halifax Little Sable Island.
MLA Chender.
Good morning, Claudia Chender, MLA Dartmouth South.
MLA Churchill.
Zach Churchill, MLA for Yarmouth, Leader of the Opposition.
MLA White.
Good morning, John White, MLA for Glace Bay and Dominion.
I will also note that officials from the Auditor General's Office, Legislative Council Office, and Legislative Committee's Office are in attendance as well. On today's agenda, we have officials with us from the Department of Health and Wellness, Nova Scotia Health and Emergency Medical Care Incorporated, regarding the 2023 report of the Auditor General Ambulance Ground Services. And just for folks who are making their first appearance here at committee, I call upon you to speak, and your microphone should light up, and then you can start talking, so just so you know how that works. I am going to ask the witnesses to introduce themselves, beginning with the witness on the far right, Deputy Minister Lagassé.
Good morning, everyone. Jeannine Lagassé, Deputy Minister of Health and Wellness.
Okay. All right. Okay. Mr. Beaton.
Good morning, everyone. Craig Beaton, Associate Deputy Minister, Department of Health and Wellness.
Mr. Fraser.
Good morning. Jeff Fraser. I'm the Executive Director for Department of Health and Wellness of the EHS program.
Ms. Oldfield.
Good morning. I'm Karen Oldfield, Interim President and CEO at Nova Scotia Health Authority.
Dr. Boutilier.
Good morning. Nicole Boutilier, Family Physician and Executive Vice President of Clinical Operations and Medicine.
Mr. Daniel.
Good morning, everyone. Charbel Daniel, Executive Director of Provincial Operations with EMC.
Ms. Poirier.
Good morning, everyone. My name is Paula Poirier. I'm the COO for the EHS Operations.
And Ms. Jensen.
Hello, my name is Jan Jensen. I'm Executive Director of Medical Communications, Patient Flow, and System Performance with Emergency Medical Care.
And because we have a cast of thousands, just so I know who is going to be speaking when a question is asked and who's going to answer, if I could get a nod of recognition, a flicker of the finger or something, then I'll have a clue who we should go to, okay? So I will invite Deputy Lagassé to make opening remarks.
Thank you, Madam Chair. Before I begin, I would like to recognize all of our paramedics, some of whom will receive long service awards at a ceremony this afternoon. Whether you have 40 years of service or are just starting your career, I want to say thank you. The Auditor General's report confirms what we already know. There are system pressures and challenges affecting ambulance response times that must be addressed. We agree. That is why we have accepted all of the recommendations. There's a lot of work underway to improve emergency care, some of which includes more and better equipped ambulances, more staff in the Medical Communications Center to divert non-emergency calls to the right service, new patient transfer units, more medical transport vehicles, a single paramedic emergency response program, and a new second transport plane to move non-critical patients between Halifax and Yarmouth and Cape Breton. The issues impacting ambulance offload and response times are not confined to EHS operations alone. They are system-wide. A recent letter from Canada's emergency physicians to the Prime Minister and all health ministers and premiers speaks to the challenges we are discussing today. It talks about the lack of hospital capacity, primary care providers, and acute care nurses as the main reasons for ED congestion and lengthy ambulance response times. It notes these issues are happening across the country and that these pressures have been building for some time. Primary care, hospital care, long-term care, mental health and addictions, emergency care. They are all connected parts of one whole, where challenges in one area create challenges in others. When you compare the actions we've taken against the pleas of Canada's emergency doctors, you will see our priorities are very closely aligned. In many respects, Nova Scotia is ahead of the curve in implementing the strategies they have called for, including better care management and focused investments in primary care teams, better care for the elderly and most seriously ill, and training, educating, and recruiting healthcare professionals. As we wait for new beds to open and continue working to attract more healthcare providers, we will continue to implement new approaches to better manage the resources available to us right now and to transform the healthcare system for the benefit of patients and providers. Thank you.
And then next, we go to Ms. Oldfield.
Thank you, Madam Chair. Really 5 points. In addition to what our deputy has said, I would maybe synthesize with these 5 points. This is about patients and providing the very best care possible to our fellow Nova Scotians. It is about staffing, number 2, where we continue to see challenges across our healthcare system, EHS, NSH, long-term care. This is about beds, and though we have invested and will be building beds, we sort of need them today. This is also about data and using data for informed decision-making. And finally, number 5, this is about taking actions with the input of our frontline staff. I look forward to discussing these issues with the committee today. Thank you.
Thank you. Ms. Poirier.
Good morning, everyone. On behalf of Emergency Medical Care, I'd like to offer our sincerest gratitude to the committee members for inviting us to participate in today's discussion on the findings and recommendations of the Office of the Auditor General's Report on Ground Ambulance Services. We fully support all the recommendations and are committed to working with the government and our health system partners on these recommendations. Joining me today are Jensen, Executive Director of Medical Communications, Patient Flow, System Performance, and Charbel, Executive Director, Provincial Operations. First, I want to extend my deepest appreciation and thanks to our employees for their unwavering commitment and service to Nova Scotians. They form the backbone of our operations. They're the ones you see in your community, not only as paramedics, but also as residents and active members. They know the service they provide is not only for Nova Scotians at large, it's for those who reside in their community, their friends, and families. In choosing emergency health services as a career, one is choosing to be of service to others. Through compassion and professionalism, they provide patients with high-quality emergency medical care, no matter the environment. I want them to know that we will continue to work with them to build more improvements to better their work environment. Retaining and growing our teams is a high priority for us. EMC has been the proud service provider of ground ambulance services since the purpose-built, province-wide EHS system began 25 years ago. We have and continue to work collaboratively with our partners at this table to provide emergency health system that Nova Scotians deserve. We would like this committee and all Nova Scotians to understand that we take the responsibility that we have been given as a health system operator very seriously. We recognize that the system is under strain for various reasons that impact emergency care. We will continue to innovate and work with our health system partners to ensure solutions are explored that will improve service delivery and care for Nova Scotians. On behalf of our entire team, I want Nova Scotians to know that despite systematic pressures, we will always be steadfast in our commitment to respond promptly and effectively as we continually to meet the ever-changing needs of our communities. Thank you.
Thank you very much. So how this works is that each caucus gets 20 minutes to question the witnesses. And then we sort of divvy up the remainder of the time among the 3 caucuses after that. So we start off with 20 minutes. So we begin first with the Liberal caucus and Mr. Churchill.
Thank you, Madam Chair. I'd like to thank the presenters so much for their time. This is obviously, and the Auditor General for their really important work on this file. Very concerning stats that we're seeing, particularly developing over the last 2 years. Upwards, according to the Auditor General, of an 80% increase in offload wait times in 2 years. We are seeing more paramedics leave the profession than ever before. These are the worst offload times that we've had in our province's history. And we actually have a good diagnosis from the Auditor General of why we're actually seeing such a situation getting worse, particularly over the last 2 years, where the Auditor General referred to closures of rural emergency departments. Middleton, Bedeck, I think there's been 12 overall rural emergency departments that have been closed or experienced higher levels of closure. This, of course, impacts response times across the province. We've also seen no follow-through on previous ministerial directives to deal with offload wait times in our hospitals. And the real concerning thing here that I don't think we can lose track of in the committee or in the public discourse around this is that this is impacting patients in a very serious way. You know, we've been speaking with emergency doctors who are saying people are dying needlessly as a result of the situation. So these lack of resources, the situation getting worse with offload times is affecting life and death in our emergency care. And one thing that really, I think, shocked me was that there's actually, according to the Auditor General, been an effort to report less on these offload wait times. And there's less accountability between the health department and the health authority on this issue. And so, I mean, that's really concerning for me because you have offload wait times in many emergency departments exponentially increasing. You have the overall offload wait times increasing by 80%. This is impacting life and death in hospitals in a demonstrable way, and yet we have, you know, a government that seems more interested in reporting less on these facts to Nova Scotians instead of reporting more. So my first question is, you know, why, and this is despite the fact that there's, you know, even between the contract with the MCI and the province, there's room for more accountability, more reporting, which was signed under the previous government. So, I mean, despite this fact, I do have to ask, why have we seen less reporting on these issues which are impacting individuals in Nova Scotia's lives and access to health care they need in their most desperate moments?
Mr. Beaton?
Thanks very much for the question. A couple of points that I would make. So we've actually not seen less reporting. We've actually moved to an online reporting, a dashboard that is publicly available. Previously, we did have monthly reports that were coming in, but we felt that it was more transparent to put it out publicly and make sure that those reports were going forward. Offload times obviously are concerning, but that's why there's a number of system initiatives that are happening right now to make a move towards decreasing those offload times. The Auditor General's report did confirm what we had already known, that offload times were an issue. The measurements that they did look at were from June or for up until December of 2022. Happy to report that offload times did have a significant decrease. From January until August of this year, which actually decreased by about, I think, 10 minutes collectively across the system, going down to an average of about 90 minutes. So certainly happy with seeing the progress. I think that speaks to a number of the initiatives that we've been put in play over the last 2 years.
Mr. Churchill?
I mean, I'm going to take a 2-year viewpoint on offload wait times. That is when the last election happened. That is when we started to see very serious growth in offload wait times. And I mean, the small pullback in offload wait times over the last number of months doesn't make up for the, in some cases, exponential growth of offload wait times in the province. And again, I will remind the committee, offload wait times have gone from being an issue at 2 of our largest hospitals in the province to an issue for every single emergency department in the province. And again, the Auditor General was very clear that there has been less accountability between the health department and Nova Scotia Health, and that the department ceased to monitor ground ambulance response times in August 2022. So these are very concerning. It seems the government's more interested in presenting a good public story than actually dealing with the reality on the ground that are impacting patients every single day. So certainly we hope that more public reporting happens, particularly on the ground ambulance issue, which is impacting people. And again, the situation has gotten worse over the last 2 years. We had a government that really got elected, in particular on the offload issue. We all remember the story that happened in the election that impacted the outcome, and we were told that the Premier had solutions. He was going to fix this, but in fact, we've seen the opposite happen and a situation get drastically worse under the leadership of the Premier, and with also having more control out of the Premier's office over the healthcare system, having more political control over the healthcare system, putting partisans in charge of it instead of actually having medical professionals manage our healthcare system. And this is when we start seeing things get worse. We have to look at the emergency department closures in rural Nova Scotia. I mean, two big ones that we've heard a lot about that are impacting response times in Cape Breton and in the Valley would be at Middleton and Bedeck. We've spoken with citizens in these areas, with medical professionals in these areas that are terrified that they're not going to be able to get the support they need when they're dealing with an urgent situation. We saw in the Valley volunteer fire departments being called into hospital to do life-saving procedures on people. You know, this is a very scary situation. So when it comes to our emergency department closures and the clear link between closures of our rural emergency departments, again, I believe there's been 12 under this government. What is and the link that the Auditor General has made between emergency department closures and the drastic increase in offload wait times? What is the plan to get our rural emergency departments back open so that they can be there for people living in remote areas when they most need them? I'll ask the Health Authority that question.
Okay. Ms. Oldfield.
I'll start, thank you. A lot to unpack in those remarks, and this is the opportunity, because you have in front of you the people who are working on this every single day. I'd like to maybe touch on the accountability issue first, and I think that I certainly read the Auditor General's comments with interest. I also read the departmental response. What I would like to assure Mr. Churchill through the chair is that this group of people is looking at offload data, everything impacting offloads every single day. I suppose if one were to say, you know, accountability, ultimately for the Health Authority, it rests with me. So it is very high on my list of things that needs to be attended to. We are in a crunch, and the deputy referred to the letter from the Canadian Association of Emergency Physicians, which we fully agree with. As well, there is another letter been tabled, I'm not sure if the committee has it, if not, we certainly can, by the chiefs of paramedicine, which we would also agree with. All of these issues are known, they're known to us, and the challenge is how to overcome them. We have two major problems in our province right now: a lack of beds and a lack of staff. Layering all of that across the entire province and servicing over 1 million people is no easy feat. And, you know, I really have to commend our ER medicine teams for all of the work that they do. If we could wave our magic wand and supply them with additional people, we certainly would. They are very, very challenged. So we have made certain decisions. One, a very important decision, is to make sure that our regional emergency departments remain open. If an emergency room department at a regional hospital closed in this province, we would be in very serious difficulty. So that has meant a deployment or redeployment in some cases of staff to ensure that that has stayed the case. That is a challenge in our rural parts of the province. But that certainly doesn't mean they are ignored. We've looked at alternate ways that we can assist in the rural parts of the province, and in that regard, the urgent treatment centers, while not full emergency departments, are a very important part of our path forward. And we have, there are a number of the urgent treatment centers, North Sydney, Parsbro, Tatamagouche. I think there's 8 or 9 currently across the province. And certainly, while not a perfect solution, is much better than a full and complete closure. I think that we've done many things to look at the offloads, to improve the offloads. Mr. Beaton mentioned improved times from January to earlier this summer, and that's a fact. And those improvements came as a result of very specific measures that were put in place early in the new year. Now, can we stop? No. This is a continuous loop of improvement. We have another whole raft that will be coming. The difficulty is the staff to do all of the things that need to be done. I'm going to ask my colleague, Dr. Boutilier, if she would like to add to any of what I've just said.
Before we continue with that, I'll check with Mr. Churchill to see if he wants to hear further, if he has more questions he'd like to ask. Thank you. Okay. And just so folks know, I'm just doing this to move things along, because what we've had in the past is deputies try to sort of rag the puck and then pass it down the line, et cetera, et cetera. And in order to get in enough questions so that people can understand this topic in a fulsome way, I do give MLAs the opportunity to indicate whether they want to hear from further people. So, Mr. Churchill.
Thank you so much, Madam Chair. Thank you, Ms. Oldfield, for the response. My worry is that we keep hearing that the situation is getting better and we're seeing improvements.
7 minutes.
When what's becoming particularly and acutely obvious is the situation is getting drastically worse, exponentially worse in many cases. Yes, we do have a staffing issue. That is a challenge that every jurisdiction is facing, but we've also heard from the union previously, a health committee that talked about retention issues in Nova Scotia. I think we lost 49 paramedics last year. And this is despite the fact that the government has brought in a retention bonus for paramedics. We heard from the paramedics union and from a number of paramedics, they weren't happy about that and that they weren't consulted on the retention bonus. In fact, we tried to get the union in today to present, to share their thoughts on this issue, because we know that staffing is one of the biggest challenges on this file. That was denied by the governing caucus. I think the member from Colchester said, what the heck would we do with bringing them in here to talk about their contract? Well, I mean, we don't have to talk specifics about the contract. We can talk about what paramedics are experiencing, why we're dealing with a real retention issue, why more paramedics are leaving in the last 2 years than they've ever left before out of the profession. We could hear their thoughts on why we're buying more ambulances at a time when we have less people to staff them. And we now have a quarter of our ambulances that are unstaffed at any given time on the road. Like, this is frightening. And yet we have advertising throughout the province about how healthcare is improving, when the healthcare system, in some areas certainly we're seeing better access in some elements for coldness and strep throat through pharmacists. That's a good thing, and we commend the government on that. But when it comes to services required to help people in their moments of greatest need, when it's life or death, we are seeing really scary decline in response times and in the ability to save lives in Nova Scotia. And for people experiencing this, it is a very scary thing. People are losing loved ones as a result of this. So we need to understand what the plan is to deal with the paramedic recruitment and retention issue. Because again, we are seeing more paramedics leave now than ever before. And this is, and the only real effort I think that we've seen thus far is the retention bonus that clearly wasn't There was no consultation that happened with the paramedics on this, and by all accounts, most paramedics that I spoke with were pretty upset and not happy with that bonus. Now, it was a lot of money that was spent, I think close to $400 million, not just for paramedics, of course, but for nurses as well. But to have a retention bonus that upset people more than they were before certainly isn't going to help. So what are the government's intentions in terms of dealing with the paramedics representatives through their union and addressing this major retention issue that we're having? How are we going to stem the bleeding from people leaving the system at a time when we need them the most?
Mr. Daniel. Mr. Daniel.
Okay, thank you. Thank you for the question. There's several contributing factors to the current work environment and workforce, and it's a lot to unpack, so I'll do my best to walk through the different pieces. But at a high level, work environment is one of the contributing factors. Compensation is one of the contributing factors. And the work itself is another contributing factor. So if we talk about the work environment in and of itself first, we've seen a lot of initiatives put in place with the support of Department of Health and Wellness that have helped address additional approval of vacation time to ensure paramedics get the time that they need. Policies in place to help paramedics get off on time and their shifts where they need to. With regards to compensation, we're happy to report that with the support of this government and in collaboration with the union, we've began talks in June of this year, which was actually a few months earlier than when the collective bargaining was supposed to open. And we're also happy to announce that we have a tentative agreement that is out for ratification with paramedics, which will be voted on in the next couple of days, and we'll hopefully have a result by Friday. With regards to the work itself, we have a lot of paramedics that are off because of the environment. It's a tough job. There's no question about it. We lose paramedics that go off on medical leave for either mental health reasons or physical injuries. And we've put a lot of work in those areas to ensure that we help these paramedics get back to work and have a healthy lifestyle. With regards to the mental health side of things, we've done a lot of expansion with the health and wellness team. We've added several resources in there. We've added programs such as Connect and Recover to help mirror paramedics that are off with other employment opportunities to get them back into the work environment. We've got a robust peer team that helps engage with our teams after difficult calls and difficult situations to navigate those areas. On the physical injury side of things, and I should highlight, and probably should have started highlighting at the beginning of this, that a lot of these ideas come from our frontline team members. Late last year, a committee that we formed called the Employee Advisory Council, made up of frontline paramedics, meets on a monthly basis to discuss these very issues. What is affecting the retention of paramedics and how to keep them at work and how to keep them in Nova Scotia. And so a lot of these ideas and suggestions I just talked about came from that committee, including the equipment that's gone into place, and we've seen the funding come from government to support, such as the power loads and power stretchers, the first-in medical kits, which are lighter medical bags that the paramedics carry to reduce back injuries, a new riser device that we're piloting right now to help lift patients off the ground, new, more ergonomic ambulances, new stair chairs to help move patients from different areas of homes. So there's a lot of factors and things.
Order. The time for the Liberal questioning has elapsed. Sorry, I didn't mention ahead of time that I might just, out of the blue, interrupt you there. We'll now move on to the NDP Caucus for questioning, and Ms. Chender.
I will get back to that. Good morning. There may be some repetition, but I do want to dig a little bit more deeply into some of this. So for one thing, we know that this data is almost a year old that's contemplated in the report, but we also know that things do not seem to be improving. As of September 10th of this year, the average ER offload time was 110 minutes. That's way above the 30-minute target. And that obscures the very long wait times that are above average. And many of our hospitals here experience that. So 155 minutes at the Cobequid Community Health Center, 170 minutes at the Dartmouth General Hospital, and 195 minutes, over 3 hours, at the QE2 Health Sciences Center, to which so many people are brought in such critical condition. We had a similar committee meeting 5 or 6 years ago when we were in fact permitted, per our motion, to bring the paramedics union. And when the question was put to them, what does this mean? And it's not just the offload times, it's the response times, which we'll get to. He said it means people die. And that has always stuck with me throughout my career. It means people die. And so I do want to thank everyone here. As Ms. Oldfield said, I know that you all spend your time trying to fix this problem, but it's been over 2 years. The promise was a fix for healthcare, and we haven't seen these times move significantly. I think we heard 10 minutes. I would like to see that average extrapolated amongst these different sites that I've mentioned. When are we going to meet the targets? When are we going to get to a place where we don't need to be concerned that, Nova Scotians' health and lives will be impacted by these wait times that are so far off the target of what is acceptable?
Mr. Beaton?
Thanks very much. And I can assure you that the weight of people waiting for ambulances weighs on all of us deeply across this table, which is why we've put a number of initiatives in place to try to address that. I would say that this has been building for a number of years, so it's going to take us some time to sort of get out of where we are, and I think we have been showing signs of making progress towards that. You've mentioned, an average time of 150 minutes. We do know that in 4 regional sites, the times have gone down over the last, 8 months since January. So, as I mentioned, the Auditor General's report, the data collected is up until December of 2022. We monitor that data on a daily basis with Mr. Fraser and his team. They're very deep into the analytics, as well as in conjunction with Mr. Murphy, who's also here representing or with us from Nova Scotia Health. Response times, absolutely a concern as well. We have seen a reduction in the last number of months too. Now, albeit it's only a few minutes, but it does show a signal in the right direction from 28 minutes down to 25 in terms of average response time across the system. But I do highlight that we've done some jurisdictional review across the system as well, and across Canada, the typical average offload time in terms of what they monitor in terms of a standard is about 45 minutes. Our standard is a little bit more aggressive. I can tell you that no jurisdiction is meeting their standard because of the reasons that we talked about before, which is a human resource issue. There's a significant human resource issue in paramedicine across the country. So as Mr. Daniel had talked about, there's a number of initiatives underway to try to retain, but also on the recruitment side, we're looking heavily. I do know that EMC has actually either just come back or they were in market actually in Australia looking to recruit paramedics, working collectively with our college around how we modify entry requirements and scope. So I guess in closing, I would say that we are tracking in the right direction, but it's not, there's no silver bullet. There's a number of initiatives that we have instituted that I think are making progress. So I would just highlight one in particular, which is trying to divert ambulances from actually coming into the emergency room. So we have the single paramedic response units. Those didn't exist 2 years ago. We have them now in place, and they're active mostly in centrals. Obviously, we're looking to expand that. And just to give you an anecdote about the duration of how many people that diverts from an ED, there's roughly about 6,000 average visits to the QE2 per month. And the SPEAR units are diverting about 500 per month, which, if you average that out over a year, that's a whole month's worth of ED visits diverted through this single response unit, which is actually treating people in the community. So,
thank you, Mr. Beaton. Ms. Gender.
Yeah, there's a lot in there. I think you mentioned the times. So I would be remiss if I didn't note that offload times, our target was 20 minutes, and then it moved to 30 minutes without much discussion. And while I appreciate that those times aren't being met across the country, I would say we have some unique barriers here that could be alleviated. Again, I want to note that we're not hearing from paramedics in this conversation. Their voice is invaluable here because they can speak to what's on the ground. So I'm certainly hopeful that they will. I know that Mr. Fraser was a paramedic. He's not currently in the field, and he is in a management position at Health and Wellness. So with respect, I don't think that counts in the context of this conversation.
Ms. Chender, I'm sorry, we have a point of order here from Mr. Taggart.
Thank you. Thank you, Chair. In the previous preamble, and again here we refer to paramedics, and I truly appreciate paramedics, but it was said that 5 or 6 years ago, paramedics were before this Public Accounts Committee, and so I'd like to have that tabled if I could, please.
Mr. Taggart? I'm going to add another minute onto the NDP time. Ms. Chender, sorry, no, Ms. Chender.
Thank you very much. Anyone can look through Hansard and find the record of that.
Do that during your time.
Sorry, just to get back to where we are. So we do have some unique challenges here, and ones that I think could be addressed. And so, what the main one, I'm glad that we have paramedics in market, that we have, people in market in Australia, but we are bleeding paramedics here, and one of the reasons is compensation. We have the lowest compensation. Glad to hear that there's a contract coming, but there are many things that we hear from paramedics that could be done. We hear that they don't actually feel supported in their health and wellness. We hear that they don't feel supported in their return to work. This is anecdotal, but these are a number of conversations across the province that we have, and so I will leave that with you since we don't have that voice in front of us. But I do want to just turn to responsibility. So I love that we have a team here and that, it's all hands on deck. But at the end of the day, my understanding is that the Nova Scotia Health Authority is ultimately responsible for offload times. Of course, that's via EMCI, who is the provider, but Nova Scotia Health Authority, in theory, manages that contract. And so, I know that the AG's report did suggest that the response to recommendation 1.5 around managing that contract is insufficient. So I guess this is for the deputy. I want to ask Ms. Lagassé, who is responsible for this? At the end of the day, where does the buck stop in terms of ensuring that we have accountability and we turn it around?
Thank you.
DM Lagassé.
Thank you for the question. So I think we've already had a bit of discussion about this, and Ms. Oldfield spoke to it a bit earlier, but as the Auditor General herself says in the report, the system is extremely large and complex. And as a team, and that's why there are so many people here today, we are working toward just solving the challenges and pressures that are within the system, including offload delays, which will then also lead to increases, hopefully, in response times. But in doing so, we have to look at all of those problems as a system. And we can't look at things in isolation and hope that a change in one area is going to be a change in the other. So from an accountability perspective, as Ms. Oldfield said, there are 3 of us here who are ultimately accountable for our organization. There is no question about that. But the value that the health leadership team is bringing is we're trying to solve those problems as a system. And so the health leadership team is ultimately accountable to the minister, but we can't do it, my organization, Ms. Oldfield's organization, Ms. Poirier's organization individually. We have to do it together, and that's what we see the value in the health leadership team and that system accountability. There's, yes, individual organization accountability, but it's about the system, and that's why we're doing it together.
Ms. Chender.
Thank you. Okay. I want to move on in a minute to the human resources piece that we talked to, but before I do that, I just want to go to the ER closure question, because although we do have those urgent treatment centers, although they are playing a role, my understanding, and you could correct me if I'm wrong, Ms. Oldfield, is that They actually don't impact ambulance offload per se because ambulances can't offload. And so in those centers, and this is what we hear from paramedics, right? Like, you know, if we get a call in Middleton and Middleton is closed, then we might be driving to Kempville or we might be driving to Yarmouth. And if we're driving to Yarmouth, that's a real problem for everyone involved. It's a problem for the patient. It's a problem for us. It's probably a problem for Yarmouth down the road. How's the patient going to get home? Our understanding, based on the accountability report, was that emergency room closures doubled year over year last year. And the human impact of that, of course, is Nova Scotians in communities across the province who cannot access emergency care in an equitable way. And so my specific question is, when will those ER closure times improve, or can we just not expect to have emergency rooms in smaller communities in Nova Scotia?
Ms. Oldfield?
Thank you. I would never want to give up and say that will happen. So our job is to work as hard as we possibly can to recruit and to put the right skill sets in the best place possible. So I'm not going to throw in the towel on rural emergency departments. No. However, we have to do something, hence our urgent treatment centers are something. You know, this, to a rural Nova Scotian, I would say, you know, you've got to do more, Karen. You got to do it a lot faster. I hear this too every day. I talk to our staff, I talk to people. I've been around this province 3 times in 2 years, talking to stakeholders, to people, to staff. I hear the same things that you're hearing, and I don't sleep very well because I'm looking for the silver bullet. I'm looking for the needle in the haystack. It just doesn't exist. So, yes, we're recruiting. We're recruiting NPs, we're recruiting nurses, we're recruiting physicians. We're making strides there. We're creating seats. We're doing all of the things that Nova Scotians would hope and expect us to do to start to make strides on the human resources. We can't wave the magic wand, but we are making progress. We've created the new physician assistant program starting at Dalhousie University. We've in the midst of starting up a medical school at Cape Breton University. The list could go on, and I'm sure we'll have an opportunity through the session here today to discuss. But you know, you're right. It's a challenge, but we can't just solve it with a snap. It takes a long time to produce a qualified healthcare professional. So we scour, we go where we need to go to bring people to this province. We can't do it fast enough.
7 minutes, Ms. Chender.
Thank you. Well, that's actually a great segue, because it does take a long time to produce a healthcare professional. It is much more inexpensive and effective and ultimately good for the province if we can keep the ones we have. And we have been bleeding paramedics for a long time now. And so I guess one of the things that I want to get to is, why haven't we had more of a focus on retaining the paramedics that we have in this province? So, you know, paramedics were excluded from the MOST program expansion that this government kind of put out at the beginning of their mandate. They didn't get those incentive bonuses to train in paramedicine, local Nova Scotians. They didn't receive the lauded raise that the CCAs received outside of collective bargaining. We can talk about whether or not that was a good thing or a bad thing, but it retained some CCAs who are in those positions. And their compensation has been stuck at the bottom. And what we hear from paramedics, and we've heard this for years, is we're the best trained and we're the lowest paid. And so people used to train here get on a rig, because you could do that, and Jeff is nodding, Mr. Fraser, he knows this is true, and then they would leave. So they'd get the experience they needed, and they'd go to Ontario, or they would go to Alberta, or they would go to a place where they could make twice as much money with the experience that they got in Nova Scotia from our system, and that hasn't stopped. The only thing that has stopped is they don't stay to get on a rig anymore. And in some cases, they don't even sign up for the training. And so it's a dwindling pool, but we have paramedics here who are leaving in droves. And so my question is, what is the, I'd like to hear the specific efforts at retention that are happening right now in terms of compensation, in terms of health support, because it's a very, very challenging workforce, and I have ethical concerns about bringing people here to do these jobs that people are burning out from day after day after day and expecting a different result, right? We can't do the same thing and expect a different result, and it feels a little bit like that's what we're doing in terms of workforce.
Mr. Daniel.
You go first.
Oh, Mr. Fraser.
Thank you for the question. I think to echo what Mr. Daniel had said earlier, it is a tough environment. To answer your question around retention, the department put together a committee about 2 years ago, really focusing on recruitment and retention initiatives. The first part of that thrust was about bringing people in. Well, we knew that we needed to try to get the union and the company to the table early, which we were successful in. Now that process has to unfold, and hopefully that we'll be able to address some of those issues through that process. That's just one part. The retention issue is, and Mr. Daniel said it's a tough environment right now. And to be clear, I wouldn't want to represent that. To your point, is that I'm not in the field and not in the trucks anymore, but yet very well aware of the challenges that are out there. Nothing more frustrating to hear from a paramedic or to be one and to see the last ambulance in the community go for a call for a patient that may not necessarily need transport to the hospital that goes already to a busy hospital. Our focus in doing what we can do with the box we have to work with really is about improving the experience for the patients that we see and improving the workplace conditions for paramedics. And our focus has been on keeping people out of the emergency department that don't need to be there. And there are many things we need to do, but that's really been some of the focus. Some of those ideas, Ms. Chender, have come through EMC's Employee Advisory Council. To give you an example, the direct to chairs directive piece that the department helped EMC put in place was a result of that. Experienced paramedics seeing patients that believe that they can jump the queue, so to speak, by using the ambulance service to go to the emergency department, when really it's not an emergency visit they need an alternate care pathway. So our focus in the last year is trying to improve the workplace conditions by providing paramedics options that they can do with their patients versus just the traditional take people to the emergency department. Many things to do, but those two things, getting to the table early and trying to get an agreement, a tentative agreement that we can get ratified, and then focusing on what's in our control from the work environment. And so along with that come the supports in place for paramedics that weren't there before. We have a physician 24 hours a day, boots on in that center, that's there to help guide paramedics through some of these difficult decisions and conversations they have to have with families. The nurse program that we put in place is really more about creating capacity and giving a patient a better experience. We've only been up and running since November, and I understand people's patience, but there's been a lot of investment that now has been sunk. It's in place. Now we have to just see what's going to happen. Our non-critical care aircraft. I can tell you as a former operations director at EMC, when I would go to Sydney and Yarmouth, I would often hear about the paramedics and about how long they'd be out of their communities, how uncomfortable it was for their patients. This aircraft really, we've only had this in the air since the 7th of August. And from the 7th of August until the 30th of September, we've moved 132 patients and returned about 1,320 unit hours to create capacity in communities. Nothing's fast enough, and nothing's fast enough for me. But we just continue to push. So as we get these programs up and running, then we look at what else can we do to improve the patient and the paramedic experience, all the while improving the public safety piece.
Ms. Chender, 1 minute.
I only have 1 minute. What I did want to ask about, and maybe my colleague will pick up on this, or my colleagues in the opposition, is the contract with the MCI. So Nova Scotians feel like we have a public ambulance service, but we don't, actually. We contract a private company, and that's a $165 million contract, and my understanding is that no penalties have been paid. regarding performance standards. I understand there are choke points, there's primary care issues. Nonetheless, we do contract to private companies, so I wonder whether there will be penalties. There was a recommendation from the AG's report, 1.3. The department says it's going to take another year. If someone could speak to that in, I don't know, 20 seconds and maybe pick it up after, that would be great.
Mr. Fraser?
Yeah, absolutely. So we're really looking at, we need an exemption process. Ms. Chender, I think we're trying to
Order. Sorry about that. We'll now move on to the PC Caucus for questioning. And just so folks know, the second round of questioning will only be 6 minutes because we have a lot of committee business. Mr. Young.
Thank you, Madam Chair, and I'd like to thank the Auditor General for her hard work on this report and her recommendations. I just have to say, I find it kind of ironic that the former health minister can sit over there and point fingers after 7 or 8 years of their inaction. We finally have a government that's actually listening to healthcare workers and working to improve conditions. It's not going to happen overnight, but we're listening and working hard to improve things for Nova Scotians. I have a question, or I'll direct this to Department of Health and Wellness, or EHS, but could you talk about the efforts that are currently happening to recruit and retain more paramedics?
Mr. Daniel.
Thank you for the question. So our focus, so we are laser focused on the retention and recruitment of paramedics in this province, and we are not leaving any stone unturned. I spoke earlier about the Employee Advisory Council that we have formed, which we use as a guidance on what are the best ways for retention of paramedics, what to do in the work environment, what to do from a health and wellness standpoint, physical injury standpoint, and the work itself. As my colleague, Mr. Fraser, mentioned earlier, some of it is focused on the work and the work that they do, it being rewarding, making sure that our clinicians are focused on doing the clinical work that they've been trained to do. And we've seen that by what we've done and how we've enhanced the service delivery and patient care and quality care in this province by expanding the transfer service through non-clinicians and having paramedics focus on the work that they've been trained to do, by expanding the single response units and growing that system within Nova Scotia. Again, creating pathways for our teams to grow. On the compensation front, as mentioned, we are in collective bargaining. There is a tentative agreement on the table right now, and it is out for ratification over the next couple days. And we are excited to see the votes over the next couple days and where that takes us. You know, previously there was a comment about why wasn't this addressed earlier, and we do have to respect the collective bargaining process. It is a 3-year contract, and this vote will tie in a bargaining or a collective agreement for 3 years as well. On the recruitment front, we have been working tirelessly across the globe. The shortage of paramedics that we see in Nova Scotia is across every jurisdiction and every part of the globe, as we're witnessing right now. One of the challenges and upsides to Nova Scotia is that we have such a vast scope of practice for paramedics here on what they're able to do. That's the upside. The challenge is that mirroring that scope and care of what paramedics get to do in Nova Scotia for recruitment becomes a challenge, because we cannot just recruit from anywhere. Hence the focus on places like the United Kingdom, the USA, Australia, parts of Europe, the Middle East, India, where we've been traveling to and working on these recruitment efforts. Locally, there's been a lot of initiatives that have been supported by this government to help increase the number of paramedics in this province that are trained and taking the programs. First off, we see the expansion of the programming across the province, where we've seen classes now starting in Yarmouth and Stellarton with a focus on trying to train paramedics in the communities that they live and where they want to work. We've seen subsidy announced by this government for $11,500, which covers nearly 60% of that tuition, and in return has a 3-year service agreement for paramedics to stay in this province and work within this system. We've seen a graduated license a little over 1.5 years ago, which has reduced about 4 months of time from a paramedic by the time they complete their programming to entering the workforce. Previously, they had to wait to take their licensure exam, and that takes quite a bit of time. Now they're able to enter quicker. And most recently, as of 2 weeks ago, we saw the announcement specific to Nova Scotia, where paramedic students or students that want to become paramedics can apply for student visas and streamline to take the program here and enter a process where then they can get their work visa and permanent residency and so on and so forth. So all of these barriers that are coming down are definitely streamlining and easing the process to increase the workforce. But as mentioned by all of my colleagues here, it takes time.
Mr. Young.
So we know there's challenges around staffing shortages, and they're leading to delayed response times due to lack of coverage. I'm just wondering, how is the MCI working to ensure EHS has adequate staffing and coverage?
Mr. Daniel.
Absolutely. So I touched on some of these earlier through the Employee Advisory Council and how important it is for us to retain our workforce. But really, it's the model change and the system design that we've been working closely with the Department of Health and Wellness on, and moreover about providing the right resource for the right patient at the right time through feedback from our frontline staff. So when we talk about the expansion of the transfer service and what we've done there over the last couple of years and continue to do, especially through the launch of the fixed wing a couple months ago and further transfer units being added to the system, these have added capacity to the system. They've added capacity to our 911 ambulances to respond to 911 calls. And it's introduced a different level of care, a different practitioner called the clinical transport operator, of which we've recruited over 150 of over the last year and a half to supplement our team. This allows us to leave the ambulances in their communities, respond to the calls that they need to respond to, and not do the transfers that they've been previously assigned. To put that into context, 80% of all transfers 2 years ago were done by ambulance. That means they did 45,000 transfers across the province. Today, we're happy to announce that these ambulances are doing less than 14%. That's under 10,000 transfers. That means 35,000 transfers they used to do, they're not doing anymore. They're being available in the communities. They're responding to 911 calls. Moreover, building on providing the right resource for the right patient is with our single response paramedics. We know and we've seen 70, even up to 80% of the calls we receive are low acuity. They're non-emergent, and a lot of those don't need or require an ambulance or a trip to the ED. So in growing that side of the service, which also just recently, a couple of years ago, was introduced, in collaboration with the virtual care team that we have in the comm center, made up of a physician, nurse, and paramedic that are stationed there 24 hours a day, which, may I add, is one of the only comm centers that has that in this country, work to address these low acuity patients and provide them alternate pathways, provide the means to have their needs met without having to be transported by an ambulance or to end up in an ED where they're not necessarily need to be seen. It's these types of programs, these initiatives that we've been planning and putting in place over the last couple of years that are truly expanding our service and ensuring that we've got the right resources for the right patients. And so moreover, I guess what I'm getting at is it's not just about adding more ambulances to the system. If that's all we did, if we didn't expand a transfer service, if we didn't introduce a single response service and added ambulances into the system, then we would just be transporting more people to the hospitals and where they don't need to be.
Ms. Sheehy-Richard.
Thank you, Madam Chair. I just wanted to talk about, I looked through the report and the recommendations that are there, and I'm happy to know that they're all been accepted. And I understand from reading it that some of them have already been implemented. And I'm just wondering, the ones that haven't been and they have targets, what kind of things that you're going to do to work at addressing the recommendations collectively, and also how you were able to act on a couple of them so quickly. So maybe towards the department.
Mr. Beaton?
Yeah.
Sure, yeah, thanks. Happy to take that question. You are correct. We have been acting on a number of them, and I'm happy to report that 3 of those recommendations are already completed and implemented. But I just want to give you a little bit of context as well, because this has been ongoing work that we've been doing since the Fitch report was tabled, a number of years ago. One of the things that we've done internally was we had a functional assessment done within our division about in 2001. Some of the recommendations that came out of that outlined some gaps that we had in terms of our oversight. And what we quickly were able to realize is that we didn't have the clinical expertise within the EHS division that we needed. So we were able to put out a recruitment campaign and able to fill those positions. Happy to report that we actually were able to secure Mr. Fraser here, who's a 30-year paramedic, also worked with EMC for a number of years, was no longer working there, and quickly onboarded into the role, and we've been increasing our capacity within that function ever since. As a result of that, we've been able to move really quickly on a number of initiatives that Mr. Daniel has outlined. To the tune of about $27 million in the last 2 years, which is a significant investment in EHS. And as we've said earlier, like those are just starting to sort of take root, and we're starting to see progress within those initiatives. They're going to continue to build on in the future. In addition to that, Ms. Oldfield talked about data. So we're laser focused on data as well, and part of our review outlined that we were insufficient in our capacity on data. So during the audit period, we've actually staffed up on our data capacity, and we are actively monitoring data on an ongoing basis, which I think addresses some of the questions around how do we monitor the contract going forward. And with the chair's permission, I would offer Mr. Fraser to talk a little bit about that, but that would be, I'll leave it up to you.
If you'd like to hear more. Would you like Mr. Fraser to speak further?
Yeah, I'd like to hear more.
Mr. Fraser?
Thank you for the opportunity. So ADM Beaton's point is we had to build the capacity to be able to do this in our team, and we moved from a contract manager into an active regulator. That role for us is a bit different because really it's a balance of advocacy and accountability that go into that. A lot of focus these days around response times. This is important to people. It's important to us as well. However, we are moving towards a different type of response reconciliation process that focuses on outcomes. Very few jurisdictions in North America have undertaken this piece. Not only EMC, but the department has also received some information from Fitch about how important this is, and we're watching a place in Tennessee that's moved to this. Essentially, the issue here is speed is important, but the quality of care is probably more important. And just being quick doesn't necessarily equate to quality care. And so what we intend to do as an active regulator is build a process where we will monitor response times, we will reconcile response times, but it's about, did we choose the right paramedic? Did they take the right route? Did they perform the right medicine? And what was the patient's outcome? That's what we want to move into. Response time management in EMS, and I myself have been involved over 3 decades, and I've seen this progress over time. First around, as all of our systems here, Ontario, BC, collectively got together and began to organize and deliver service, it was all about speed, setting out accountability. The next iteration of that is how well do we do? Has it improved the patient's outcome? What I can tell you is that every patient doesn't need an ambulance less than 30 minutes, less than 15 minutes, and less than 9 minutes. What's important is we put the right practitioner with that patient. ADM Beaton spoke earlier about the SPEAR units, the single paramedic units. Those units focus on low acuity. We have a lot of low acuity patients that we see in the EHS program. And by giving these patients options, has them a part of solving their own issue. 1 year of my career that I stepped out of the EHS system, I had the privilege of being the executive director for 211, and I get to see another aspect of people and what can happen when you can empower them in making their own decisions. And this is exactly where we want to take this service to. So although we may not be as quick as the AG and others would like, the reality is we want to do this well, and we want to have something meaningful at the end of the day that we can actually say the changes we made in the system have improved outcomes for Nova Scotians. Not just speed, it's about the outcomes, and that's really what our focus has been.
7 minutes, MLA Sheehy Richard.
I just also want to, as we talk about our population growth and, record-breaking and the announcement of bringing in some paramedics from abroad, I'm just wondering about the system pressures that the AG did mention in her report, and there's 2 factors that do contribute to that, population growth and our aging demographics. So I guess what I'm wondering is what are we looking at towards how we can address that growth? What are we doing to build a healthcare system that will bring us into the future?
Mr. Fraser.
Thanks for the question. So again, it goes back to programming. So the EHS system just doing things the same way, which is being dispatched and arriving and then transporting to the hospital, is what we're trying not to do. There are a number of our patients that are sick. We need to make sure we have got the capacity so we can be there for them when they need us. But the other patients, again, it's about creating a different experience for them. And so we're trying not to do the same thing. We talked about the Fitch recommendations, that Fitch report that was received in 2019. You know, there are a number of initiatives around community paramedicine. We intend to expand on that in the future. At the moment, we're really about shoring up our base and making sure that we're able to meet the mandates and the challenges ahead of us. But our focus in the not too distant future is about holistically having, you know, purposely built units that are deployed to be able to give the patients what they really deserve. And that's what our focus is. It's going to be on delivering better care across the system.
Emily Sheehy-Richard.
I just want to say, I do want to say that when I was door knocking and I started early on, so I had a year before the campaign really, the election was called, and on the doorsteps I can remember repeatedly being asked, why are we not looking at that report, and why are we not looking at these recommendations? So it is refreshing to hear that that work has already been being done, and hope that as we continue to build on that and see what improvements that is making a big impact on people's lives, both those that work in it and those that are receiving treatment from it. It's good to hear, but I know that a few of us on the table have questions. So I'm going to pass it. I think if my colleague, Mr. Taggart, is ready, we'll pass the question to him.
MLA Taggart?
Thanks, Chair. What's the time left?
About 5 minutes.
Thank you. So,
4.5.
Thank you, Madam Chair. So my question is to Department of Health and Wellness. The Minister of Health from the previous government in 2019 and 2021 issued 2 separate directives to Nova Scotia Health in relation to offload times at the emergency departments, and offload times went up again just a few short months after the directives were issued. Offload times continues to be a consistent pressure affecting response times highlighted in the AG's report. In budget 2022 and 23, $3.4 million was added or allocated in part to enhance virtual care services at emergency departments, and an ED improvement plan was released in the spring. Can you speak to the impact this is having or will have in helping with offloads? I'm particularly interested in the virtual care emergency rooms, and how is this making a difference, and who staffs it?
Mr. Beaton.
Yeah, sure. I think I can start, and then maybe I can pass it over to my colleagues at SH to give you some specifics about the virtual emergency care. But there are many initiatives that are underway. I think we talked about a number of them that are geared towards improving offloads. One example would be in 3 different hospitals, we have offload assessment teams whose role is to really try to look at triaging patients to be able to move them either quickly into direct-to-chairs, as we've talked about earlier, one of those policies. As well, we also have instituted, I believe, in 5 different locations, and Dr. Boutilier can talk more about this, but it's a program called Float MD, where we actually have physicians that are doing triage in conjunction with the paramedics to help move patients through the system quicker. But for additional specifics, I think if Dr. Boutilier could maybe take a bit in this one.
Dr. Boutilier?
Thanks for the question. Very glad that you mentioned some of our other opportunities, because really ED offload is a symptom of the whole system overcrowding, and every bit of our system is impacted. You know, with this problem, our capacity has grown over the last few years. We're doing more and more surgeries. We've increased our number of long-term care patients. So all of those pressures impact this. So everything we can do to kind of offload from the emergency room is important. We've created over 55,000 appointments just in July alone for like primary care access that didn't exist before with various different platforms. And with the virtual ED pilots, we're looking at offloading even more folks that can have faster service if they go through a different route. We've had 2,400 appointments recently that have been, you know, diverted through the virtual care ED. all of these things work together to help offload these increased pressures of our system. We know from the Need Family Practice Registry that 50,000 people that have come into the province without care. So it's, the population growth, the age of the patients. Our numbers continue to climb with ALC, long-term care, and long-stay patients in hospital. Our capacity runs regularly at 110%. We're continually finding new ways to change our models of care to deal with not only the staffing pressures, but also the new pressures that we feel from the various points in our system that are happening. So virtual ED is one of those things. We have, the things inside the emergency room itself that we've looked at, Float MD, giving all the regionals the opportunity, if they have the staffing, to create another physician path to the hospital to actually be in there with the paramedics and actually assessing the patients quickly. And really, Colchester, for instance, has implemented that fully, and they've cut their weight offload times in half over the last 9 months. There was something mentioned earlier about nobody meets the target. Well, St. Martha's and Aberdeen meet the target regularly and have employed some of these strategies fully, and we continually try to learn from our colleagues in different places.
Time for the PC questioning has lapsed. We'll now move on to Liberal questioning. The second round is 6 minutes, as I mentioned earlier. Mr. Churchill.
Thank you very much, Madam Chair. I do want to thank the member for Shelburne, I think, for providing an example of one of the issues that we have in the political leadership in the government. A government that ran on a promise to fix health care, but now that they're 2 years into their mandate and the situation's getting worse, the tactic becomes to point fingers and lay blame. And I will say that's very different than what we saw from the public servants at the table today, who are taking responsibility, who are working to achieve improvements, folks that I used to work with as well. And I do think this is a problem with the governing elected caucus, is that it seems to be a party that's more focused on the politics of healthcare and less on the outcomes of healthcare. And the member said, they finally have a government that's listening to healthcare workers. In some cases that's true. People do feel heard by the government, and credit where credit's due. But on this issue, this is also a PC caucus that voted down a motion to have paramedics present themselves at this committee. When, as the Auditor General highlighted, and again I'll highlight to the member for Shelburne and the members of this committee, this report comes from 2022. And decreasing access and the situation getting drastically worse under this government, not a previous government. They said no to paramedics coming in, despite the fact that we have more paramedics leaving this past year, the profession, than ever before. We've gone from having a 3% rate of ambulances being understaffed to 25% being understaffed. Offload wait times are the worst we have ever seen in our province's history. More people are dying in hospital. We're hearing from emergency doctors that people are dying needlessly, in part because of ambulance wait times and the offload wait times. And we've had a diagnosis of this in the Auditor General's report, pointing very specifically to actions that this government has or hasn't taken that have contributed to this: closing rural emergency departments, allowing more paramedics to leave, delaying the biggest healthcare development project in our province in a generation, and less accountability between the health department and the health authority, as more of the health authority's work has come out of the Premier's office. And then the government has the governing caucus has the nerve to take credit for things that were done under the previous government, while they point figures and lay blame on a previous government, like the Fitch report.
Circle of life.
And these sorts of things. So I do think we need to see the elected government, who was elected to fix healthcare, take responsibility and be accountable for this, and be less interested in trying to blame everybody else for every single challenging issue that they have to deal with. They're in government now. They're no longer in opposition. And I think if they take that mindset, we'll actually start seeing, hopefully, some more improvements in healthcare. One thing that the Auditor General did point out that I do want to ask about, she did highlight that when ministerial directives were given in 2019 and 21, that we did see a reduction in offload wait times. Are those ministerial directives still being utilized.
DM Lagassé.
Thank you, Madam Chair. The directive and the standard of 30 minutes, yes, is still in place. I think we've spoken a lot today about our efforts to try to get there. We are not there. We know that the Auditor General's report has confirmed that, but we are working tirelessly to try to get there.
Mr. Churchill, 2 minutes.
You know, we have heard about moderate improvements in offload wait time, but I do think it's important to put that into perspective for the committee. For the offload wait times remain between 153 minutes to over 170 minutes. Dartmouth General is over 100 minutes. That was the previous one was at the QE2. Cape Breton Regional is over 100 minutes, and the Cobequid ED is over 100 minutes to offload. The report outlines that the QE2 remains to only meet the 30-minute offload mark 9% of the time, and Cobequid and Dartmouth General only meet that 8% of the time. So yes, we've seen some moderate pullbacks, I think temporarily, in offload wait times, but we have seen exponential growth. And as the Auditor General pointed out, we've seen close to an 80% growth in offload wait times in the province, just over 2022. And again, we have a government that doesn't allow paramedics to present at this committee while they say that they're listening to healthcare workers, and at a time when we have more paramedics leaving the profession than ever before. We have a caucus that wants to pat themselves on the back and point fingers and lay blame when more people are dying in and outside of hospital, when less people are getting critical care they need, when more people are waiting longer for ambulances, and where paramedics are stuck, sometimes 12 ambulances deep, at our emergency department trying to get patients into hospital. We do need to start seeing some responsibility taken at the political elected level on this issue, or we're not going to get anywhere. So I will ask...
Order. Time for Liberal questioning has elapsed. NDP, Ms. Chender.
Thank you. I'm just going to take a moment because, as has been mentioned, our motion to bring the IOUE before this committee was voted down by the Government Caucus. And because Mr. Taggart somehow wanted, or MLA wanted to challenge the notion that I raised that here, I will read from the March 14th, 2019 meeting of the Health Committee. Hansard, Tammy Martin. Being from Cape Breton, I have known many instances where there have been 0 ambulances available in CBRM. I also know that sometimes the nearest ambulance is in Bedeck or Antigonish. If that was my family member who needed an ambulance, let me tell you, you would hear me screaming from the rooftops. What happens when I call an ambulance, God forbid, in New Waterford, and the nearest ambulance is in Bedeck? Terry Chapman, then business manager of IOUE. You wait. Tammy Martin, my loved one has just had a cardiac arrest. Terry Chapman, you wait with a person who will probably be non-living when they arrive. Tammy Martin, how that doesn't infuriate the people of this House boggles my mind each and every day. Terry Chapman, I agree with you. That was 2019. All of the statistics have gotten worse. We'll table that, and I think it's very relevant to this meeting. And I'll turn it over to my colleague, Ms. Lachance.
MLA Lachance.
Thank you. So I'm gonna make the most of the brief minutes that we have left. You know, I appreciate the large team, and I know that people are working hard to make the healthcare system better in Nova Scotia, and I know it's a system. I do understand that. But at the same time, we have a contract in place with a private sector provider for these services, and contracts, by their nature, are detail-oriented and contain obligations and conditions, and that's an important piece of the puzzle. So, you know, there haven't been any penalties paid for failing to meet performance standards. And so I'd like to revisit that question. Why? And when will performance standards be held to account within this contract? And if we're not holding them to account in this contract, how do you decide which contract you let go or which standard you uphold?
Mr. Beaton?
Yeah, thanks for the question. I would refer back to some of the comments that we made earlier around some of the changes we've done within the EHS branch, really moving from, as Mr. Fraser has said, what I would say is sort of a contract manager to an active regulator, and part of that is looking at the ways in which we monitor response times and performance standards broadly within the contract. I can tell you that we have taken steps with the data that we're currently collecting now to sort of look at hold the contract as it currently sits to ensure that those standards are being met. We've had those meetings and discussions with the vendor, EMC, who is here with us today, and they are aware that sort of we're stepping into that role, and that going forward, as Jeff has outlined, there will be outcomes that are going to be based on clinical outcomes that we will be monitoring within the performance.
Chance?
So will penalties, as provided for the current contract, be levied against the provider?
Mr. Beaton?
If the conditions are met that warrants the penalties to be levied, yes.
Chance?
And when will that start?
Mr. Beaton?
Well, we're actively monitoring the performance right now, so it would depend on whether or not performance targets were not met.
2 minutes. Chance?
One of the things in the responses was around the use of the audit clause, and the Auditor General, recommends that the department use the audit clause. The response from the department is not quite clear if a review or audit has ever taken place. So has it, and can it be provided to the committee, and if it hasn't, why not?
Mr. Fraser?
Thank you for the question. Oops. Thank you for the question. I'd wait till the red come on. So as we had indicated earlier, as we're building that capacity, so one of the pieces of moving from a contract manager into a regulator was to have data independence. So we built, in partnership with EMCI and our own folks at the department, a data pipeline which allows us to go in and actually monitor things live ourselves and look. So that's been a build over the last year and a half. It certainly is a priority for us, but along the lines, we're also trying to increase capacity at the same time. So I think if you go refer back to the AG report, you'll see in there that they surmised that the operator can't hit the targets because of the challenges we're having around the offload pieces. There is no doubt that as we see improvement in the offload pieces, we were watching very closely. EMC is absolutely in tune, and these are issues that we talk about on an ongoing basis. To give you a concrete date would be difficult at this time because the answer is it depends. There's a number of variables are in place. However, the department has been building the capacity, and again, I go back to not just looking at whether or not we arrived on time, but looking at the entire piece. How did we do? That's the important part. So that build is underway. I can't give you a date today, but it is an absolute priority for us.
Chance, 10 seconds.
I appreciate the response, but I think, we need to hold the service providers to account.
Order. Time for NDP questioning has lapsed, and we move on to PC Caucus. Mr. Taggart.
Thank you, Madam Chair. A little bit earlier in our session this morning, the previous health minister said we should talk about work that was done by the previous government. And we all know that long-term care beds and the need for long-term care beds and getting folks out of the healthcare system in the hospitals is critical there. And so it's my understanding that when we came into power or took responsibility, there were over 500 long-term care beds empty at that time, and recently they've been filled and others additional ones opened. And secondly, I was happy to see an update to the province's build plan for long-term care facilities. In Nova Scotia, we'll have another 1,200 new long-term care rooms and replace another 2,300 by 2027. So that's real action when that's at least 500 beds added, you might say. So with that, I'll turn my time over to MLA White.
Mr. White.
Thank you. I did sit here for quite a while, and I listened to the former health minister also say that this government needs to start listening. I just want to point out the fact that we had a Speak Up for Healthcare tour right from the beginning, and in that tour, what we heard from healthcare professionals was that there was a dire need for Cape Breton to have a cardiac cath lab. not just a bigger emergency room, which I give them credit for announcing. Absolutely. I really feel that politics needs to come out of this because we need to sit down and talk together because I am not a paramedic. But I will tell you, I had the unfortunate reality of working next to them as a medical first responder. And what those folks go through on a daily basis, you've touched on what the job is. We should be doing everything we can, and party colors should mean absolutely nothing. And I really am disappointed to hear the former health minister say he's going to take a 2-year window looking at ambulance drop-off times, because that is very convenient for him right now. The changes we put in place are historical. I'll say that. I'm on record. It's historical what we've done, and I really feel that we're just starting to see some of those changes. It takes time for things to happen. When I think of the long-term care beds, when we took over, there was a 200 and some day wait list. It's down to 50-some days now. I understand that every long-term care bed in the system is now open. That opens up beds in the hospital. It makes sense. And I would really like to see that the former health minister come on side and start contributing some real solutions instead of sitting here criticizing and picking numbers. I'm sorry for being negative, but that is a fact. Ms. Oldfield, can you tell us about some of the changes that a health system that support keeping people at home, closer to home, where they need to be? Because when I go back to the cath lab, for example, I think it's 10 days right now for somebody in Cape Breton to get a catheter put in. It's supposed to be 24 hours. So just ambulance time, it just, the system relies on each other. Can you speak on that, please?
Ms. Oldfield?
Sure. One of the principles that we have adopted and are working across the system is to try to find ways where people can receive care closer to home. That's particularly the case when it comes to Cape Breton or further extremes of the province like Yarmouth or the northern parts of the province. So, my colleague Mr. Fraser mentioned the Life Flight example. We've talked about the patient transfers and some of the community care options that have been put in place. That's very helpful. Some of these, like our virtual, I don't want to underestimate what we've been able to do and what we will be able to do around virtual. Dr. Boutilier talked about virtual emergency Nova Scotia. An important statistic, she did mention the 2,400 consults. These are people that present in the emergency in their home area, are treated virtually, and of those 2,400 consults, 1,946 were for prescription renewals. So what does that tell you? I think that tells us that and it's something we've known for a long time, that we have to put a lot of emphasis around our primary health care. And we've done that. We've done that through opening different access pathways in community. So for example,
Time for PC questioning has elapsed. We now have time for 1 minute for each of the entities to make closing remarks if they would like, beginning with Deputy Minister Lagassé.
Thank you, Madam Chair, and thank you to the committee for having us here today. We'd also like to thank the Auditor General for her report. It really has allowed us to focus on some initiatives that we had underway and to give us some good recommendations for implementation. I would just like to assure the committee that the team that is sitting at this table today and our teams back at our offices and various locations throughout the province are working tirelessly on this issue. We are leaving no stone unturned, and we are working very, very hard to reach the standards that we know Nova Scotians deserve. Thank you.
Thank you. Ms. Oldfield. Oh, Dr. Boutilier.
Thank you. I just wanted to take a moment to thank our staff and our leadership who every day come to work and face the challenges and face them head on and come to work with an attitude of we can fix this and we want to do the best we can. I had the privilege of being at the Quality Summit for Central Zone yesterday and hearing about the frontline staff and how they're impacting everything that we do and things that they're putting in place. So I wanted to take the moment to thank them.
Thank you. And Ms. Poirier? Oh, Mr. Daniel.
Thank you. I want to share a recent quote that I read, and I may slaughter it a little bit, and I apologize for that, but it goes along the lines of somebody somewhere is sitting in the shade today because somebody planted a tree a long time ago. And let's not kid ourselves about the work that's happening in the last couple of years. We're planting a lot of seeds. We're in a place we've never been, trying to get to a place that we've never been, and that means we have to do work that's never been done before. And sometimes that work isn't all favorable, but that's the cost of making difficult decisions in difficult times. I'm confident that with all the work that's happening in the near future, we will all be sitting in the shade. Thank you.
Thank you very much. With this, committee members, you're free to go. We are going to take a 2-minute recess, 2 minutes only. I'm going to ask everyone to pick up their stuff and move out because we have lots of committee business to do. Thank you so much for coming. We are now in recess for 2 minutes.
You did say everybody, right?
Mix la chance.
Thank you. I think that was, a really important discussion, but I think it's really just the start. So, I think from this really critical report, we can see that Nova Scotians remain at risk when they seek emergency health care. And I think there's a wealth of information that we just didn't have a chance to get through today. A number of recommendations that really no one was able to touch on and have a discussion about. So we don't have answers on how the government will hold EMCI accountable for medical record uploads, when a paramedic staffing plan will be ready. We didn't have a chance to ask about bonuses for EMCI management, exit interviews, and we also didn't have the chance to hear from paramedics themselves. So I move that the Public Accounts Committee add a second meeting on its schedule on the topic of ground ambulance services with the witnesses, the CEO of the Nova Scotia Health, the Deputy Minister of Department of Health and Wellness, EMCI, and IUOE 727.
Thank you, Mix la chance. Any discussion on that?
It's just the...
Mr. Nolan?
Mr. Young.
Yeah, my apologies, Madam Chair. I was just looking at the order of committee business and stuff and following the agenda. We have tremendous...
I'm trying to get some topics in here. If we can move through this quickly. This is related to what we would normally do, which is the endorsement of Auditor General recommendations. So the member did signal that she wanted to make a motion related to that. because it flows out of that. So if we could just deal with this motion, please. Any discussion on this motion?
Yeah. So,
Mr. Young.
Could I suggest that, like we do have an agenda-setting process, like that, you know, this is a very important topic, that we could perhaps submit this during, as a potential topic during the agenda setting?
Mix Lachance.
I certainly appreciate the role of process and process following, but we are discussing this right now, and we just had it. We just, you know, we're able to have a fulsome discussion, but there's so much more in this report, and it's so critical for Nova Scotians' health that I think we need to spend more time digging into these, the recommendations and findings. I don't understand why the government would be reluctant to have another discussion on health priorities and on this really critical issue. So what I'm suggesting is essentially, I'm not attempting to circumvent any process or any agenda setting process. What I'm suggesting is that we didn't finish with the topic today, and we need more time with it.
Certainly, I will recognize that we did not have as much time as we often do, simply because we had so much committee business to do today. So I will just say that. Mr. Not Churchill, Mr. McGuire.
Thank you. So I'll be the first to put it in the record, but I agree with Dr. Lachance on this. I think that this is a very important topic, and obviously, you know, we're hearing, I mean, I think from a government side, I think it went fairly well for them today. Like and so I don't know why they wouldn't want to continue along with this. So we would be in support of bringing some of the witnesses. We don't have to have them all, but it's a very important topic, and I think if this is truly a government that's looking to fix healthcare, I think these kind of conversations help.
Mr. Young.
And listen, this is a tremendously important topic, absolutely, and it's I guess I'm not trying to defer anything. I'm just trying to go through the process here of, you know, we've had committee business with witnesses for several, I think, weeks we've been dealing with this now. So, and I agree, it's important to Nova Scotians, it's incredibly important. But I'm going to make an amendment that we defer that topic to the next agenda setting.
Thank you, Mr. Young. With the committee's indulgence, I just want to move on. We need to get topics selected. So would the committee members please agree to vote now and cut off discussion on this particular item?
Because he has a motion to defer, though.
Mr. MacDonald.
I promise it's quick. I'm just wondering if the Auditor General is going to be bringing this back anyways as a follow-up. That's my question. That's why I said it was quick.
It's in 2 years. Mix Lachance, if you don't mind, we're going to vote now, okay?
What are we voting on?
We are voting on.
There's a motion to defer, though.
He's moved to defer.
Yes, it has to be go.
Sorry, I didn't hear a motion. I didn't hear the word motion. Sorry?
I said amendment. I said amendment.
I'm so sorry. I apologize. I missed that. So we'll now vote on the amendment to defer.
The motion to defer.
No, it's
not really an amendment.
It's a motion to defer.
Yeah.
So you said it was an amendment, but it's not an amendment, it's a motion. Is that right?
Yeah.
Madam Chair, just quickly.
No.
I need
Oh, my.
procedure here. Well, I need to know on procedure, and it's only fair that we know. So we have two motions on the floor. One is to defer. So does that nullify her motion?
No, it just defers. If
No, it just defers.
depending on what the result of the vote is.
So hers is.
So hers was on the agenda first. His came up, so it's like an amendment, but it's not an
It's not an
amendment.
amendment. It's a decision by the committee to put off further discussion of the motion until a future date. So a motion
And
to
so-
defer is
so-
always in order.
So that's the one that we vote on first?
Yes.
He's asking to push her motion on. Her motion is to do that.
So we're now voting on the motion to defer. All those in favor say aye.
Aye.
Contrary-minded, nay.
Nay.
The motion is carried. Ms. Lachance, Mix Lachance.
So actually, that was what I was going to just address is, you know, I think I often sit in a chair-like position, and I know how difficult it can be, but if we can refer to members, because there was a bunch of pronouns thrown around there about hers, and I have asked very specifically in this House, and the Speaker of the House has made it clear that my pronouns are they. So their question would have been much more appropriate. So I would ask all members to keep that in mind. But we could all just call each other MLA LaChance, MLA White. It cuts out all the need to worry about stuff like that.
Thank you, MLA LaChance. I apologize if I was one of the people who did that. I probably was. And I do apologize on my behalf and on behalf of committee members who committed the same error. So we will now move on to endorsement of our Auditor General recommendations. We don't have to deal with MLA LaChance's motion, correct? Because it's been deferred, correct? Correct. All right. Now let's move along to the endorsement. MLA Sheehy-Richard.
Okay, I move that the Public Accounts Committee formally accept and endorse recommendations contained in the 2023 report of the Auditor General, Ground Ambulance Services, Department of Health and Wellness, and Emergency Medical Care, Inc., that have been accepted by the audited departments or agencies, and ask that those departments and agencies commit to and take responsibility for full and timely implementation of the recommendations accepted by those departments and agencies.
Any discussion? All those in favor, please say aye.
Aye.
Contrary-minded, nay. Motion is carried. Now we'll move on to the record of decision from the September 20th subcommittee. Members have been provided with the record of decision from the September 20th subcommittee meeting. A motion was left on the floor at that meeting regarding the topic investments in affordable housing programming, including student housing needs. The motion is as follows. To split this topic into two. One topic would be investments in affordable housing, including student housing needs, and the witnesses would be the Deputy Minister of the Department of Municipal Affairs and Housing, a representative of the Affordable Housing Association of Nova Scotia, the Chair of the Executive Panel on Housing in the Interim, and the Deputy Minister of Advanced Education. The second topic would be investments in initiatives to end homelessness, and the witness would be the Deputy Minister of the Department of Community Services, a representative of ADSUM for Women and Children, and a representative from the North End Community Health Centre. That was moved by MLA LeBlanc. The amendment was to split the topic into investments in affordable housing programming with the following witnesses: Deputy Minister of Municipal Affairs and Housing, Chair of Executive Panel on Housing and Interim, and the Deputy Minister of the Department of Community Services. And that student housing needs be added as a separate topic with the following witnesses: DM of Municipal Affairs and Housing and Deputy Minister of Advanced Ed, and that was moved by MLA Taggart. The sub-amendment was to amend the witness list to include a representative from City Council and or a representative from the Municipal Housing Authority, moved by MLA McGuire. I will now open the floor for discussion, or we could just vote and actually have a topic. Seeing no discussion.
This is the sub-amendment.
So with the sub-amendment, correct, we're voting on the sub-amendment to amend the witness list to include a rep from City Council and or a rep from the Municipal Housing Authority. All those in favor, please. Mr. McGuire.
We will get to a vote, but I just want to say, just for the record, for those that didn't see it yesterday in Department of Community Services Committee, the Mayor of Bridgewater was here and specifically talked about this and said that the municipality is being left out of these conversations. NSFM has been very clear on this also, and so we now have municipal leaders on the record saying they're being left out of this conversation and they want to be part of the solution. And I'll leave it at this. One of the things that he touched on was the recent announcement of public housing by this government, which is great. But what the mayor said was they are not going to be able to do it because they don't have the infrastructure in place, water and sewer. So if we're going to have this discussion and if we're going to move forward with this, we need to have everybody at the table. There's absolutely no reason why a nonpartisan member of a municipality or NSFM should not be here for this discussion when they were here yesterday begging to be part of the discussion. Thank you.
Thank you. All those in favor of the motion, please say aye. Sub-amendment. Sub-amendment. All those in favor of the sub-amendment, please say aye. If the clerk could do the roll call?
Mr. White? MLA White?
No.
MLA McGuire?
Yes.
Ms. Chender is absent. MLA Lachance?
Yes.
MLA Sheehy Richard?
No.
MLA McDonald?
No.
MLA Taggart?
No.
MLA Young? And the chair.
Yes.
3 yeses and 5 noes.
The motion is, the sub-amendment is defeated. Then the amendment to, this was the one by MLA Taggart, to split the topic into investments in affordable housing with the DM of Municipal Affairs and Housing, Chair Executive Panel on Housing and HRM, and the Deputy Minister of DCS, and that housing needs be added as a separate topic with the following witnesses: DM of Municipal Affairs and Housing and Deputy Minister of Advanced Education. Any discussion? MLA Lachance.
Can I just clarify, please? So does that, so that motion by MLA Taggart effectively changes the motion by MLA LeBlanc? Okay. So can I comment on it then? Can I make a comment on the motion?
Yes.
Okay.
Yes.
So I think, I really appreciate the addition of student housing needs, but I'd like to retain as well, a focus on homelessness. And I really do think we need to hear from the Department of the Deputy Minister of Community Services, and we also need to hear from folks who are implementing these programs. So add some from Women and Children and the North End Community Health Center as well. So I don't know if I'm not supporting the amendment as proposed by MLA Taggart, but I am suggesting that we would support it with the re-addition of the witnesses cited above, and that homelessness remains a part of the title of housing needs, I guess, housing needs and homelessness, but it was, yeah.
Mr. McGuire?
I mean, I just want to put it on the record here that, Mr. Young, the Vice Chair, and others on that side have talked about when it's time to pick topics and when it's time to add topics. When we try to do that, they tell us that there's a process to go through, and literally this is what they're doing now. They're splitting a topic into 2, so the hypocrisy of this is not lost on me and hopefully the member on the side. But the truth is that when we try to do that, you tell us that there's a process and there's a topic selection committee to do this, and now you're saying that you can't do this. You just said it to the NDP, that there's a process to do when it comes to topic change or topic selection, and now you're adding another topic without going through the proper process. Again, I just wanted to point that out and put it on the record.
Thank you very much. Could we please vote on this?
Just to clear the record.
Well, folks, put your hands up, because thank you. All right. Mr. Young.
Thank you, Madam Chair. But just for clarity, it was the NDP that suggested to break this into 2 topics, so I don't know. I disagree with Mr. McGuire's premise.
All right, so we'll now vote on the amendment. All those in favor of the amendment, please say aye.
Aye.
Contrary-minded, nay. The motion is carried. So now we have to vote on
Gordon, the amendment basically nullifies this.
Yes.
Is there any point in voting on that?
Well, this is now, because
Because it's an
just
amended.
procedurally, but
Just procedurally, yes, but it's the amended motion.
So now we are voting on the amended motion, which is to split the topic into 2 investments. We've just been through what the amendment was, so I'm not going to read the whole darn thing again. So we're now voting on the amendment. Mr. McGuire. On the amended motion.
So to be clear, this is to take one topic and turn it into 2 topics?
The amendment.
What the amendment was that we just voted on, that's what this new motion is
So we're adding
now.
a new We're adding a new meeting and a new topic is what we're doing here without going through the proper process.
What's amending?
I'm just saying. Subcommittee. That's what subcommittee's for.
So, are we done with our comments? Can we vote? All those in favor of the amended motion, please say aye. Aye. Contrary-minded, nay. The motion is carried. We'll now move on to childcare. So information was sent to members seeking clarification relative to the topic Canada-Nova Scotia Child Care Agreement. Is the committee interested in the Canada-Nova Scotia Canada-wide Early Learning and Childcare Agreement or the Canada-Nova Scotia Early Learning and Childcare Agreement, which are apparently two different things, which I don't think people realized? Or we could just say, why don't we just meet on both, and that way we don't have to have a big, long discussion here about which is which. MLA Lachance.
Thank you. So I do believe that it's the early learning and childcare agreement that we're particularly interested in hearing about. So both, sure, sounds like we'll cover it, but just to make sure that both doesn't dilute.
So just to be clear, the only difference in the titles is one includes Canada-wide and the other one does not. Both of them have early learning and childcare agreement in them, right? So the only different, so there are two different things that are being, there wasn't, we just want to make sure we're reading on the right, we're meeting on the right one. We understand that it is the early learning and childcare agreement, but there's one that's Canada-wide and there's one that's the Nova Scotia. So, Mr. McDonald.
I'm fine with both, Madam Chair. I mean, let's make it easy, because the same group's going to be here. Each caucus can ask their questions. So we're fine with both, and that makes life easy.
Thank you. Any further conversation?
Do you want to ask to extend or not?
No, there's no point. Okay. All those in favor of the motion, please say aye. Aye. Contrary-minded, nay. Okay, the motion is carried. Mr. Young.
I'd like to make a motion. I move that for the topic climate change adaptation, EMO funding, and preparedness for emergency disasters in Nova Scotia, output-based pricing systems for industry, the following witnesses be called. The Executive Director, EMO, Deputy Minister, Municipal Affairs and Housing, Deputy Minister, Environment and Climate Change, and Deputy Minister, Public Works.
You guys need finance public works?
No, that's fine. Okay, we moved ahead here.
Yes, we're looking for our paperwork from
You're
the
on the
meeting.
October 4th record of decision now, right?
Yes, so it's the same messages, right?
October 4th, here we are. So just for clarity, Mr. Young, did you move the, would the committee like to extend this 5 minutes? No? Okay. Well, it's the witching hour, folks. Time has elapsed for our committee, and just so folks know, our next meeting is at next week.
On the next page, I think. Oh, no, there it is.
October 11th, 2023, Department of Finance and Treasury Board and Nova Scotia Liquor Corporation read the June 2020 report of the Auditor General, NSLC, Phase 1, and May 2021 report of the Auditor General, NSLC Phase 2 from the 2023 report of the Auditor General, follow-up of 2018, 2019, and 2020 performance audit recommendations. Meeting is adjourned.